child has died here in Michigan from the flu. That makes 4 pediatric deaths already this year, and 2 adults have died too. Because of the severity of this illness, we've been taking action all day long, having doctors answer your questions about the flu. Carolyn is joined right now by 2 experts who can help us, fight the flu.
Absolutely. Thanks a lot, Stephen. Dr. Faris El-Qadir is with the Detroit Medical Center and Wayne State University. And Dr. Talat Danish is the medical director for the City of Detroit's Department of Health and Wellness Promotion and the Institute for Population Health. And we thank you both for joining us tonight. We really appreciate your time. So, Dr. Danish, let's start with you. Tell us, why is the flu season this year so bad? Not just here in Michigan, but really across the country.
Yeah, the public health departments are actually getting concerned a little bit because in previous years, the flu season has typically peaked end of January, early February. And we are seeing that peaking happening now, beginning of January. And so there's a little concern. We still do not know if it's going to be as severe, as a result of it peaking early, whether it's going to be a severe season or not. But we still have to, we are watching and surveillance is on board.
Yeah. Absolutely. Dr. El-Qadir, how long is a person contagious after getting the flu? We know there are 285 confirmed cases here in Michigan.
Right. So a person can be contagious 1 day before the onset of symptoms and 5 days after the onset of symptoms.
Wow.
Well, we have different things that can prolong that period, including the strain of the virus, how much the person has of the virus in their body, and their immune response. Now, the best advice that I can give to families out there is, first of all, to avoid close contact with the person who are sick at this time, to drink a lot of water, keep hydrated, and to wash their hands with soap and water and alcohol-based rub if available.
Really good advice. Okay, now we did have a flu hotline earlier, but a lot of people have been talking to us on Facebook and on Twitter. Stephen, what are people wanting to know about the flu?
Well, people have a lot of questions, obviously, about this. David Gacker asked a question that I have not heard the answer yet to today. Do you require a flu shot after you contract the virus, or is it too late? And then again, Donna D just tweeted, can you get a flu shot if you have a cold? So both those questions.
So let's ask about the flu shot once you have the virus, Dr. El-Qadir.
Yes. Now, you have to remember that there are many things that can give you flu-like symptoms, other viruses and other strains of the flu virus. So in this regard, I'd say that, yes, you would need to go out and take your flu vaccine.
So still get the flu shot?
That's right.
Okay, and Dr. Danish, what about if people have a cold? Should they still get a flu shot if you're feeling sick from the cold?
Yes, because a mild illness is not a contraindication for the flu shot. However, if somebody is moderately or severely ill, they should actually postpone the flu shot till they feel better. And like Dr. Qadir said, there are many strains of the virus, so you should still get the flu vaccine because you may be infected by a strain that's not part of the flu vaccine. So you'll still be protected if you get the flu vaccine against the strains that are within the flu vaccine.
Well, we do know that 4 people have already died. Stephen, do we have any more questions?
Should I get my kids vaccinated late in this game? Tricia Fuller-Nip asks, so is it too late to get your kids vaccinated even though
What about for children, Dr. El-Qadir?
So the CDC recommends that children above the age of 6 months are vaccinated against the flu.
And even now, January, the flu season is going to go until May, so...
You never know when the flu season ends, so yes, it's a good idea to go out and get the flu vaccine this season.
Okay, and one last question for you. Because we've had 4 deaths, why will someone end up being sick and then dying from it? A lot of people are shocked.
So people in the high-risk groups, such as the elderly, the very young, and those with, medical conditions such as asthma, diabetes, and heart disease, they are at a higher risk, actually, of getting complications from the flu. So a number of these deaths actually are in the high-risk category. So we are a little concerned because in January alone, we've had 4 deaths. In previous years, in the entire flu season, we would have about 6, pediatric deaths. So we're still watching it. We really don't know if it's going to be a very severe season. It could just be early peaking and then,
Okay. Yeah. All right. Well, thank you, Dr. Danish and Dr. El-Qadir, for your time tonight.
Thank you.
We really do appreciate it, helping out our viewers. Stephen, I'm going to send it over to you.
All right. Thanks. You can count, of course, on complete coverage.